Hey guys, so for my special education video, I did emotionally disturbed disabled, but just an abbreviated shortened form. It's could be called emotionally disturbed. It's emotionally disturbed children exhibit emotional, behavioral, and interpersonal problems. It's a condition that is characterized by having one or more of the following characteristics over a period of time and to a marked degree which adversely affects educational performance. So the students have to have one or more of these. So it's an inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers or teachers or friends, inappropriate types of behaviors or feelings under normal circumstances, a general pervasive mood of unhappiness or depression, and lastly, a tendency to develop physical symptoms or fears associated with personal or social problems. So, just a little overview of the prevalence of EDD. It's over 20% of the school population can qualify as emotionally disturbed, with a gender ratio of boys being 1.7 and girls being 1. Approximately 8.3 million children ages 4 to 17 years old are emotionally disturbed, and 2.9 million are prescribed medication, which is, of course, not a lot if you're looking at the ratio of how many children develop it. Emotionally disabled children show the greatest variability in prevalence of any disability category. And lastly, 2% of students with ED are underserviced because of confusion, ambiguities, and differences in the definition and the interpretation of what is emotionally disturbed disabled. The comorbid mental disorders are the most prevalent that are comorbid with EDD are ADHD, ODD, which is oppositional defiant disorder, separation anxiety, anxiety disorder, like just general anxiety disorder, and then bipolar disorder. The intermediate prevalence, which is the middle, is conduct disorder, over anxious disorder, and simple phobia, just a simple phobia. And then the least prevalence that is comorbid with EDD is depression and social phobia. So overall, 55% of the disorders occurred in combination with one or more of the or one or more of other disorders, and 45% as a single disorder of just EDD. So what are the symptoms of EDD to just look out for as future school counselors? So it's hyperactivity, which also is short attention span and impulsiveness. Also is children tend to show like aggressive behaviors or self injury, which is children could either act out, they could fight, or just do any kind of behaviors that could injure them. Another symptom is withdrawal, which is students are not interacting socially with others, or they have an excessive fear or anxiety. Another is immaturity, which children will tend to cry, have temper tantrums, and just like poor coping skills. They just don't go well with coping skills. And then lastly is they'll have learning difficulties, which will overall affect their educational performance. So they'll academically perform at a lower grade level. What are possible causes of EDD? So it could be hereditary, so it could be genetics, it could be in their family, or it could be a certain brain disorder, or EDD could be developed because of stress, just anything like anxiety, anything that causes like stressful things in your life could cause this, especially if these students are coming from low income families, like it's more prevalent in low income families, or their just overall upbringing and their family, like their functioning could affect these students in which they develop EDD, or just certain eating disorders also could develop. Overall, African American students are more likely to be identified as emotionally disturbed than any other racial and ethnic group, which I found really interesting. What are some of the consequences to EDD? So these students overall have a high risk for negative developmental outcomes, but specifically, it could also affect like their school, how I mentioned before, their educational performance, which could result in like school failure, relationship issues, whether it's interpersonal relationships, drug and alcohol abuse. These students are more likely to be involved with just like the criminal justice system, unemployment, poor community adjustment, and just various mental health problems. So, what is the treatment of EDD? So, what could school counselors do? School counselors could teach stress management skills. They could also teach relaxation training, like kind of like deep breaths or meditation, just to like relax these students, or teach other coping skills that work with each specific student. Of course, not every technique works with every student. Or they could do talk therapy. They found that cognitive therapy was really good. This kind of therapy minimizes the student's anxiety by learning alternative ideas and learning that feelings and moods alter behaviors. What they also found that behavior theory is also really good, and it works well with these students because they learn how to cope with difficult situations at home or in school in a more positive way. Another form of therapy is interpersonal therapy, which could be really good and benefit these students. Also, these students would benefit with overall structured learning environment. So it would be good for counselors and teachers to collaborate with one another about like the accommodations for this student. Highly interactive, like direct instructions from teachers work well with these students. Also, because these students are struggling academically, peer meditated learning, which is peer tutoring, where a student works with his peer or her peer, they work really well with that. And lastly, teachers demonstrating a strong repertoire of behavior management skills works really well with these students. So again, counselors should definitely collaborate with teachers on how to accommodate this specific population of students who are struggling with this disorder. So the protection from the law. So Individuals with Disabilities in Education Act, also known as IDEA, requires that special education and related services must be made available free of charge to every eligible child with a disability, specifically this disability as well. These services should address that students' individual needs are associated with their disorder or disability, emotionally disturbance. Lastly, in order to receive proper services and assistance, the child must have a full individual evaluation in order to receive the different services. So, what are some methods of support and assistance that school counselors as well as teachers could do to help these students with EDD? So school counselors and teachers can collaboratively create educational programs by improving their emotional behavioral support. Also, counselors could help students master academics by setting them up with peer tutoring, like I just mentioned, help improve their social skills, increase self-awareness over their behaviors, or their emotions and their feelings. Self-control counselors should think about trying to improve with the student and help them with that, and also improve their self-esteem. School counselors could also encourage positive behavioral support in the school environment, which I touched upon before, just to improve their behavior that is appropriate within the classroom, because like I said, that they tend to have temper tantrums and cry. So it's good for the counselor to speak and help the student on the behavioral aspect. And lastly, when developing an IEP for children with behavior, it could impede their learning. So it would be good for school counselors. They found that it would be beneficial that they develop positive behavioral interventions, strategies, and support. So, what is the future direction to help support and assist these students with EDD? It was found that the field needs to create which interventions work best for whom and under what circumstances. Because, of course, like we've learned, not every technique and not every intervention fits each student. Every student is different and they require something different and respond to something different. Professionals need to focus on how children who have emotionally disabled can be assessed sooner and served sooner. So as I mentioned before, students with EDD sometimes get underserviced, so they're kind of they're an underrepresented population. So it's very necessary for counselors to be able to identify these students as well as collaborate with the teachers in order for them to see and identify these students and definitely tell the school counselor about them so that they could receive the assistance that they need. And then lastly, professionals need to examine the effectiveness of their services for students with ED to make sure that what they're using and their interventions and strategies and support and the coping skills are useful and they're benefiting these students and they're having an overall positive improvement and growth. Thank you for watching.